There is no cure for male patterned baldness. For most men, as their hair thins, they adjust. However, some men are not happy about this and seek solutions. At Dublin's prestigious Blackrock clinic, new high-tech surgical transplant technologies have been developed. This state-of-the-art operation is carried out by a professional team of surgeons and hair transplant technicians. The following extract from a recent TV programme demonstrates the procedure.
On Nationwide this evening, making sure they're crowned with a good crop of hair. They get it transplanted.
First of all, though, we're turning our attention to something that women rarely, if ever, have to worry about, but which affects 1 in 2 men. Hair thinning and baldness is a fact of life, and most men don't welcome it. In the Blackrock Clinic in County Dublin, there's a surgeon who specialises in the latest technique in hair transplant. Dermot Peavoy has the story.
At the Zoo Hair Salon in Exchequer Street, Dublin, it seems to be business as usual today. The owner, Shay Dempsey, is having a busy day as he tends to the copious locks of clients. However, today, Shay's own diminished locks are very much on his mind.
In my sort of 30s, I'm 35 now, say 30, I could sort of say to myself, God, I'm going to go bald. I had this it sort of hit home. It was all of a sudden, it's transparent, I could actually see it, and I didn't like that. It wasn't a thing where I was used to like shaving it off, because I did that. So it was, in fashion-wise, I would still do that. But the fact of having no hair was the big problem. It was not having the shaved head. You still know there's hair underneath, whereas this was like, Phil Collins, and I didn't like that.
So Shay decided to have a hair transplant. He had his first transplant operation earlier this year. Today, he has his hair cut short in anticipation of a second operation tomorrow. He is not at all shy about it. His salon even carries books on hair transplants, and he discusses his operations openly with regular clients.
Got to get the stitches back out after 10 days, and literally from about there to there.
Is it sore?
Not at all. No. Your head is basically like a block of wood. They work on the back area first, and then they work up through the front, and as they go along, they localise it so it's like
you
feel no pain. This area here, it's really starting to thin out. You can really see that this hair here is depleted, but they have filled in certain areas, like these guys here, and through this area. So I think what they need to do is work from the back, as they've worked from the back, and start to now fill in this section here.
I don't want to come down too low. Do you think that's too low?
By early next morning, Shay is dressed in surgical blues at the Blackrock Clinic. The new hairline within which the new transplants are to be placed is marked out carefully on the head.
I'm happy with that.
A photograph is then taken for the record. Shay then has his head prepared for the taking of a strip of donor hair from the back. The surgeon, Maurice Collins, has calculated how many hairs he'll need. The donor strip is then marked, measured, and shaved accordingly.
Oh no, I'm difficult finding it.
Shay is now ready for surgery. The next step is the delivery of a local anaesthetic by injection. When his strip of donor hair is removed, it will be used to give Shay transplants of follicular units. This method is the current gold standard in transplant surgery. Today, Shay will receive grafts of over 1,300 follicles. Each follicle can have 1 to 5 hairs. So Shay may go away today with 4,000 newly transplanted hairs.
People think that hair grows out from the scalp as a single unit, but in actual fact, you do have single hair follicles, and a follicle is the little family. But you can also get 2, 3, 4, and even 5 hairs as a single entity.
It'll soon be time for the donor strip to be removed.
By giving them some very mild sedation. They're still awake, and Shay is chatting away to us there quite comfortably. But his pulse rate has gone right down, so he's nice and relaxed now. All right, Shay? Yeah. So it's very important when taking the strip out that we don't damage the follicles. We look at the patient's requirements, and we've assessed that Shay needs 1,300 grafts today to deal with the problem that he has at the moment. So we did a calculation of his density, and on that calculation we then cut a strip which was 1.2 centimetres wide by 14 centimetres long, and 2 people started what we call slivering, and it's a bit like cutting slices of bacon. Each sliver is taken off, but it's meticulously dissected. And then those slivers are then given to other people in the cutting team, and they will then dissect out the individual follicles, and then the individual follicles are trimmed of excess tissue.
There are 8 people in the team today. They come from Russia, Belgium, Wales and England, as well as from Ireland.
And what we have here is got 2 hair follicles.
People don't realise how skilled this is. The skills aren't in Ireland, but we're training up Irish people at the moment. I think the different cultures here are a tremendous benefit to the team, and it's very much a team effort.
And then they'll be ready for planting.
If the graft is dehydrated, it's dead within 10 minutes. There have been studies done where people traumatise the grafts, squeeze them, push them, pull them, and they survived once they were kept moist. But even if they're handled very delicately, but they're allowed to dry out, they die very quickly.
Hair at the back of the head is everlasting. It's immune to the hormone that causes baldness elsewhere on the head. That's why the donor strip is taken from the back.
This is going to be totally covered. Nobody's going to ever see this. It's very, very important that everything is done perfectly.
With his bandaged head, Shay Dempsey may look like a war zone casualty at this moment, but there's not a bother on him as he takes a scheduled break from surgery.
Everything is now ready to go in, so I'm on the home stretch, as they say, but this is the one where it takes a little bit of time. So it's a lot of time in the chair, a lot of hours now while they pop them in, but I feel great, I feel fine.
Following his break, Shay is back in the chair for surgeon Maurice Collins to make incisions, tiny holes in the scalp, more than 1,300 of them to receive the transplants. First, he has to be injected with more local anaesthetic.
We do the anaesthetic very slowly. If the fluid is put in too quickly, it hurts, so he shouldn't really, just feel a slight stinging sensation, that's all.
I'd say it'd be pass out time for me now if I had to see it, so I'm delighted to be down here and they're up there.
You can't see a thing.
Can't see a thing and I can't feel a thing, which is even better still.
Then, as Maurice Collins begins to make his incisions, Shay relaxes by watching a movie.
We distract the